spike in ROS, which actually triggers defensive mechanisms. So you can use this prophylactically prior to surgery, prior to exercise. This is an interesting one. It's about exposing people to ultraviolet light. So one limb gets some LED treatment to it, the other one doesn't. And the days leading up to exposure to ultraviolet light, and then increasing amounts of ultraviolet light cause more and more erythema, which is quantified on this chart here. But the LED treatment group, limb, has a lower reaction to the ultraviolet light. Somehow we've switched on some defensive mechanisms in cells, and this has been useful in cancer patients. We're going to talk about whether or not this light not only protects healthy cells but protects cancer cells this afternoon, because it's going to fit into the contraindications section. But treating with LEDs, so skin reaction, radiation dermatitis kicks in some weeks after you start going through all these different fractions of radiotherapy, 2 or 3 weeks in, but from day one they have this treatment without any skin reaction. They're giving them LEDs every day anyway, to get to the region where they're getting the radiotherapy. And the blue bar represents the placebo group, and they're mostly grade 2 skin reaction with a bit of grade 1 and grade 3 here. But those who are in the control, in the active treatment group, are mostly grade 1 or none at all. By pre-treating healthy tissue, healthy, it's got cancer, but having radiotherapy. But treating before they have any radiation dermatitis. And we will talk about exercise, what it does for muscle fatigue in a minute. Blood flow. So I saw a presentation at a conference where somebody put LED light on a wrist, they measure increased blood flow to the hand, but it happened on the contralateral limb as well. It got the same effect in the opposite side. Why is that? We don't know. Could be a sympathetic response. Something else happened there. I wanted to see what to do with a Novithor when you climb inside it and treat your whole body. So I took a thermographic image of my hand prior to getting in the Novithor. And then when I'm lying in there treating myself, I've got one hand lying with my arm outside of it, and I'm videoing the skin temperature of my hand. And you begin to see the blood flow. You'll see the green moving up my fingers, and then the blood flowing up there, because I'm a Vulcan. If you don't know what a Vulcan is, it's because you haven't seen Star Trek. And gradually you see the blood going to my fingers without treatment to my hand. So, and I imagine when you're lying in that Novithor, that's what's happening. We're getting a lot of blood flow over it. And if anybody else has experienced it, do you feel like a pulsing side? So, do you ever feel like the heartbeat across your whole body? I do. I mean, it's not in a scary way, but it's quite nice.
Is it pulsed?
No. Well,
yes.
Technically, as we're going to find out when we do pulses, it has some very high frequency pulses. And because it's like on, off, if you want to regulate power, the easiest way that they regulate lights, most things, is changing the width of each pulse. So it has a pulse frequency. There's a very high frequency, which we know from the research has no effect on the body that's any different from a continuous being. Your body receives high frequencies and experiences them as continuous. A bit like if these are pulsed, they've got alternating current. We experience it as continuous. And so the same goes with high pulse frequencies. Low frequencies do introduce something extra. So for the sake of answering the question, technically yes, but from a therapeutic point of view, no.
So there are no low pulse frequencies in the
Not in the Novithor, no, because that would cause quite a bit of disruption to the power supply. If you do that on and off. So because it's shunting 2.5 kilowatts constantly, yes.
Have you done any imaging on lymph flow?
Yes, they had one of the very first studies. They did some doggies where they inject a dye into their pore, and then they laser the lymphatic system, then cannulate the thoracic duct, and then you can see that you get this increased flow, and the dye makes it out earlier of the thoracic duct in the treated doggies versus the untreated doggies. Yes, they haven't cannulated that in the humans. There was a fantastic thing. You can now do fluoroscopy on humans.
Yeah, I've seen that at a conference.
Right. Did you see John Porter at Belgrano? The Belgian guy?
I think so. It was only a few years ago, but they put the dye in, and then were you actually seeing the pressure that you had to exert to move
it's a rolling, stretching technique. It's a flicking thing. I've done this course.
Yeah.
So
I was just wondering
I'd like
to see
that done with light,
Yeah.
Well, they did it on doggies, but it'd be interesting to do a fluoroscopy version of it.
Yeah.
It's fascinating. That's one of the best days out I've had, just to watch that. it is. It's great.